All right, I am going to start our third lecture for E&M. But before that, I want everybody to go to exercise 11-4 in your book. Let's just run through a couple of these. So if you look at these, it states new patient services, correct? So these will be easy. If I look at, let's just say number 4, 53-year-old new patient comes in for initial office visit, right? So that tells you they're new, correct? To discuss a surgical vasectomy for sterilization. The history and exam are documented, and the medical decision making is of low complexity. So I know this is an office visit. I know it's new. So if I go to my code 99202 through 99205, they're giving us the complexity for this one. I should say the medical decision making, and I know it's low. So with that, I know that I am going to code 99203 is going to be my answer. Now if I look at the next one, number 5, new patient again, removal of sutures, made 10 days earlier. Physician spent 15 minutes with the patient prior to removing the stitches. Okay, so 15 minutes, that's going to be a 99202. They are giving us the time. So you have to look at either the time or the medical decision. All right, so let's go ahead. And there's some great other quick checks in here. You have exercise 11-5. These are established. Now, your worksheet that you'll be doing, I don't tell you if they're new or established, but I will give you hints. If I don't say initial or new, you assume they're established. All right? So, with that, let's move on to the nursing facility services and wrap this up. Nursing facility services are non-hospital settings with a professional medical staff. They provide continuous healthcare services to patients who are not acutely ill. So we have intermediate, long-term care. With this, provided at the time of admission, so this is like the admission into the nursing facility, 99304 through 99306. So let's go ahead, everybody. Let's look at those codes. Get to these codes. As you can see, these are also separated by low level of decision making or time component. So again, you're going to look at those. We have the subsequent. Now those mean like visits. All right, it's not the initial time, but these are visits. It doesn't matter for these codes to distinguish between new and established. So keep that in mind also. We also have home service codes. The care is provided in the patient's home. It's based on the history, physical, and examination, and the MDM. Codes for new or established patients. A home is the patient's private residence. It's not a assisted care facility. So go ahead and look at 99341. And as you can see with these, it's the same format as what we've been looking at. Prolonged services. All right. These codes are based on whether the visit was spent with or without direct patient contact. So they're based on whether the visit was spent with or without direct patient contact. So these codes here, 99415 through 99418, they're time-based codes for direct and non-direct services. Then you have 99417, 99418. Codes are for each additional 15 minutes. So if it is for 30 minutes, I would put, let's go ahead and look at those, 99417. It says right on there, you have to list separately in addition to the code of outpatient E&M. So if you look at 99417, it is an add-on code. Remember, add-on codes always have to be with another code, correct? All right, so that is something to remember. And the other thing with this, if we look at that, make sure you look at your chart. Over on the same page, it's a little chart saying the typical clinical staff time, time range minutes, start point. It just gives you a little breakdown. Okay, so with these, they are all add-on codes, so they need to be with an E&M code, right? So looking at these, this is a great little slide. You may want to write these little notes into your CPT book. Okay, standby service. Physician not caring for other patient to use this code 99360. Physician standing by only for that patient if needed. Even if no care was provided to the patient during standby time, you need to report and bill the service. It must be documented in the medical record. I like to give an example of, let's say we have a nurse midwife and she has a patient that she's a little leery, possibly the patient may have to have a C-section. So she calls in a OBGYN physician who does C-sections and say, hey, will you just stand by? You know, in case I need a C-section, you're going to have to come in. So that OBGYN physician can bill this service because they're only standing by in case they are needed. Case management services, these are used to report coordination of care with other health professionals and anticoagulant management. So if they're checking pro times, anything like that, or coordinate the care for the patient. If the patient is leaving the hospital, but is still pretty sick, but is able to get home care, the case management, they are the ones doing the home care, setting that up. So here we have all the different types, face-to-face, with patient family, without patient family, without patient or family. So here we have participation by physician, participation by non-physician, but a qualified health professional. All right, plan care or care plan oversight services used to report supervision of a patient care under home or any type of environment that is equal to that. Preventative medicine. Okay, this is what I want you to do. I want you to go to your CPT book. Let's go ahead and open up to 99381. 99381. This is really important. I don't want students to miss out on this. So 99381, I'm doing the same right now. All right, so as you can see here, these are new patient or established patient, correct? We need to decide which one it is first. Then it takes us to the right group. So with that, what you need to look at is the age on here. As you can see, there's no time limit, there's no medical decision making. What is the preventative medicine service? This is right here, example, an annual checkup. So as you go in yearly for a physical, these are the codes that the physician will use. They will use it according to your age and then according to if you're a new patient or established patient. What else? Okay, so a yearly physical. If you have a baby, 2-month check, 4-month check, 6-month check, 9-month check, year check. They, again, go according to the age of the baby. So when they go in for their check for those that first year, it is divided younger than a year. So the first one will probably be new patient, and after that, you're going to start using established patients on those checkups. These patients are healthy. They have no complaints. They're just going in for a routine checkup, physical. So you need to write that into your CPT book. All right, so this is interesting. If a significant problem is encountered during that preventative exam. And let's say that you go in there and we'll just say that you are having some other issues. You're having heart palpitations, or that they notice a skip in your heartbeat, or anything like that. They can go ahead and add, let's just say, a 99212-25 to the E&M code, saying, we also saw that patient not only for their annual physical, but they came in with a problem. And I want to get paid for that problem because it's going to take longer now to address. So the thing is, then, when you do the diagnosis, you're going to have the diagnosis for the annual physical, and then you make sure you also have a diagnosis, let's just say, for the heart palpitations. And the insurance company will pay for both. They will pay for both because you're adding that 25 modifier. Individual and group counseling, we have codes for those. So make sure you check those out. It could be for counseling for smoking, tobacco, alcohol. Then we have all non-face-to-face physician services, special E&M services, telephone, online, digital, interprofessional telephone, internet, consults. We also have codes 99450 through 56 used for provided for life or disability insurance. If you're looking for life insurance, a lot of times the life insurance company will make you go through a physical. These codes here will be used for that. And then we also have newborn care, right? They have their own little section. So we have newborn care, we have pediatric critical care. So just read through the different types of care that a newborn can have. And also the other thing with newborn, all right, so with these, make sure you look at the different codes. So if you look in your book at 99460, that is initial hospital or birthing center per day for E&M of normal newborn infant. Then you have 61 per day, newborn infants seen in other than the hospital or birthing center. And then 62 is subsequent hospital care. Remember, that's like a daily visit, right? It's not initial. It's not initial, subsequent. And then you have 643. This is for possibly an E&M for a normal newborn infant, admitted and discharged the same day. Sometimes if there is no health insurance on a baby and they need to get in and out the same day, this is a code that you would use. All right, you also have a 99464 is your resuscitation, birthing room attendance. We have inpatient neonatal critical services, pediatric. Just make sure you distinguish on the age of the patient, whether it's going to be neonatal or pediatric. Newborn care, I just talked about that. All right, attendance at delivery, 99464, documented by request by attending and medical record. Make sure the baby is stabilized, resuscitation, ventilation. And then we have different transport codes. There are so many codes. The best thing to do is to read through your CPT book to learn about all the different codes. All right, so with that note, we're going to wrap it up. Just make sure you read through the rest. And here's our 99499, seldom used. If you have documentation, say this all the time, do not try to use an unlisted code, a code that ends in 99. Keep that in mind. Try to find something. So this wraps up the E&M. If anybody has any questions, please contact me. It's an exciting section. And this section, other sections that we'll hit through the semester are going to build up this section. Have a great day.